Auscultate, and there were 3 parts of auscultation. We did, what was the first, where we moved in the clockwise manner? Just general auscultation for vowel sounds. Good. And then we auscultated for what? Rubs, hepatic and splenic, right? And then what did we auscultate for last? Fluids, okay? Now, inspection, auscultation, percussion, right? Now, what's the normal sound we hear here? We hear over the abdomen. Normal tone. Tympany. What was this sound over? Resonant. Tympany, right? So tympany is our normal tone. Would dull be normal over the abdomen? No, it would not be normal. Was it normal in the lungs? What did dullness represent in the lungs oftentimes? What kind of things? What's that?
Consolidation.
Fluid, right? Consolidation, fluid. Could be even effusion in the pleural space. What else could it be? Something solid. Could be a tumor, right? Those type of things. In the abdomen, same thing. If we hear dull, something is increased density, usually fluid, ascites, or something space occupying, maybe a mass of some sort. Does that make sense? So when we perform we're going to start with our general percussion, just like we did general auscultation. Same thing, 4 quadrants, clockwise, area of pain last, okay? So if he has pain here in the left or in the right lower, then I'll go. Does that make sense? All the way around listening to the tone. Cool? After we do our general auscultation of the abdomen, then we're going to move into the liver. I want to know how tall, what's the height of the liver in the midclavicular line. The liver should be 6 to 12 centimeters midclavicular line. How tall should it be midclavicular line? 6 to 12. So the way we're going to do this, I'm going to start in the abdomen. Hear the tympany? It's hollow sounding. You hear the change there? Hear that? What's that sound? What was the second sound? Dullness. Did you hear how the resonance went away? So right here, here's the costal margin. So right here is about where I would expect the inferior liver to be, right? That tells me I went from tympany to dullness. This is the inferior border of the liver. Does that make sense? Okay? Then you have your patient displaced laterally. So move your hands more vertical. Good. Now will come resonance. Hear that change? And there, you could hear it here, started getting dull. There, it's dull, right? So now, I've got resonance to the superior border, tympany to the inferior border, and what should that distance be? 6 to 12 centimeters. Is that about 6 to 12 centimeters on him? Yeah, it is, right? That's normal height. Now, if your liver's 15 centimeters high at the midclavicular line, what's that tell you? It's hepatomegaly, right? So maybe there's a mass there, maybe there's cirrhosis, it's gotten bigger, but for whatever reason, the liver has started to increase in size. Does that make sense? Now, what if my liver was 8 centimeters, but instead of being here, it was down here? Would that be normal? No. Has the liver enlarged? No, it's normal size, but it's shifted. What common respiratory pathology might cause that, and why? What's that? So you remember emphysema? What happened when the chest started to expand this way? What do we call that? When the AP diameter started to approximate lateral barrel, right? We said if you get this enlargement of the alveoli upwards, right? And that cricosternal distance would go from, say, 3 fingers to less than 1. Same thing, that same enlargement of the alveoli, distension can move downward and cause a shifting of the liver. Normal size, but displaced. Does that make sense?
So it's displacing your diaphragm.
Yeah, it's pushing everything down. Make sense? All right, so I want you to go ahead and listen to tympany and all the quadrants, and then find the lower and superior borders of the liver. Make sure it's 6 to 12 centimeters, midclavicular line.